watching Health DNA. I'm Anshu Jaising. The month January is dedicated to cervical cancer awareness, emphasizing on early diagnosis, effective treatment and prevention. To talk more about this, we are joined by Dr. Anjana Singh. She is Director, Department of Gynecology, Fortis Hospital. Welcome, ma'am. So, ma'am, what is cervical cancer?
Basically, any cancer which happens at the mouth of the uterus is called cervical cancer. As we all know, uterus has two parts. One part is the body, which is inside the abdominal cavity. The other part, which is hanging inside the vagina, is the cervix. So any cancer which happens in the cervix is called a cervical cancer. But here one thing is very important, that at times people tend to confuse cervical cancer to the cervical area in the neck. So that is also called a cervical thing, but the cancer which is happening at the mouth of the uterus is cervical cancer.
So, ma'am, what are the common symptoms of cervical cancer that we need to be aware of?
Actually, any kind of abnormal vaginal discharge which keeps coming all the time. It may be sticky, it may be thick in consistency, it may be foul smelling. So that could be one of the symptoms of cervical cancer. Apart from that, any bleeding. Apart from the regular menses which a female gets is also a symptom of cervical cancer.
So, ma'am, I would like to know, what are the risk factors associated with cervical cancer?
Basically, the most important risk factor is HPV infection. So HPV is a virus. There are certain subtypes, 16, 18, 6 and 11, which are supposed to be cancerous in nature. So if this virus, it infects the female's cervix for a long time. Suppose, it stays in the vagina for about 10 to 15 years. It may cause certain changes which may lead to cervical cancer. So HPV is a very important risk factor. Apart from that, anybody who's immunocompromised is more prone to infections. Suppose anybody who's diabetic or on immunosuppressant drugs or HIV. So these females, they are more prone to cervical cancer. Apart from that, smokers. They say that if you smoke, there are certain particles which reach the uterus via the lungs through the blood. And there in the cervix, they cause certain changes in the DNA of the cervical cells, which can make the cervix more susceptible to cervical cancer. So we should avoid that. And apart from that, low socioeconomic strata is another risk factor, because these ladies, they don't go for regular checkups. They don't understand the importance of checkups. So the cancer gets delayed in detection. Then multiple sexual partners is again a big risk factor for cervical cancer. Early age at first delivery and multiple deliveries.
Okay.
So all these factors, they can cause cervical cancer in females.
So the preventive measures would be?
Okay. So for prevention, it is very important that we go for regular health checkups. And in that, a very important test which is done is called a Pap smear. It's a very simple OPD procedure in which the cervix, the cervical fluid is collected in the OPD, and that is seen under the microscope, and we tend to see for the malignant cells. Now this Pap smear ideally should start at the age of 20-21 years, and it should be done every 3 years. That's very important. But if a female is very busy and she's not even able to come after 3 years, she can club this test, Pap smear, with a HPV DNA detection test. Okay. So if they are combined together, this can be done every 5 years, and till about 60-65 years we can continue the screening, and we'll be in a position to catch this cancer very early.
So, ma'am, how prevalent is cervical cancer in India?
As we look at the statistics, it has been seen that India is contributing about 25% of the world cases of cervical cancer. And as we do this interview here, in every 8 minutes, 1 woman is dying of cervical cancer. That is the burden. In 1 hour, 8 females are dying of cervical cancer. I mean, in a day, almost 200 females are dying of cervical cancer.
So I'm talking about the treatment of cervical cancer. What are the treatments, and does that vary from one individual to the other? So what are the treatments?
So like every other cancer, the cervical cancer also has 2 modalities. It could be surgical or medical or a combination. So as I said earlier, if it is a pre-invasive or stage 1 or stage 2B, we can go in for a surgical removal of the uterus and the ovaries and the tubes. So but these days we are also doing certain fertility preserving surgeries also, in which we tend to leave the ovaries, or we send the ovaries for egg freezing and all. So surgery can be done, and there are different modalities. We can do an open surgery, or we can do a laparoscopic surgery, or these days, as we all learning that robotics has also come into play. So we are also doing robotic surgeries for cervical cancer. But if it is beyond 2B, then we generally recommend radiation therapy. Radiation therapy could be external, like we are giving these radiations from outside the body, or it could be an internal radiation therapy, which is called a brachytherapy, in which the radiation is given through the vagina. So these are 2 modalities of radiation. And third is a chemotherapy, which could be a disease specific chemotherapy, which can be given to these females.
I'm not talking about the research and screening part. Do you see there has been some level of advancement now?
As I have been repeatedly saying, that this cancer is being caused by a virus, by the infection of HPV virus. So most of the research is on the detection of this virus at the earlier stage. So screening is very important in cervical cancer. So we've always been harping screening for cervical cancer. So most of the research is on the detection of this, and these days, apart from pap smears, there is some research which is going on putting some fluorescent light on the cervix and just illuminating these viruses.
Okay.
So most of treatment, definitely it has been there are different modalities like radiation, very target specific radiation, and so that the normal cells don't get disturbed or damaged. So there has been a very wide range of improvement in the treatment, but basically, and what is going to help a female is early detection. So most of the research is on how to catch this virus at a very early stage, because see, this virus is going to remain for 15 years before it is going to cause infection. It's not that you become HPV DNA positive and you have cancer. It's going to stay for a long time. So we have such a big window period of 10 to 15 years, and that too we miss. So basically, all the studies and all the research, is on easy technologies to, detect this virus.
Ma'am, what is HPV vaccine, and whom do you recommend HPV vaccine?
So HPV vaccine is a vaccine which is directed, as the word says, towards the human papilloma virus, which is causing this cervical cancer. So as I said, there are many subtypes of this virus, but there are 4 common subtypes, 16, 18 and 11 and 6, which is very much the reason for cervical cancer. So this vaccine has been developed for these subtypes, and this not only treats, prevents cervical cancer, it also works for vaginal cancer, vulval cancer, and for that matter even penile cancer in males, and also warts. So this vaccine can be given for 3 doses. Like if we give a dose today, it can be repeated after 3 months and then after 6 months. And they say the protection is to the limit of 94 to 95%. That is how much it is protecting a female, and it should be given the moment you become sexually active.
Ma'am, do you see there's lack of awareness among women, young women? How often do you see them going for tests?
It's really disheartening to see that, of all the female cancers, I mean, this is such a preventable cancer, but still, we generally don't tend to catch these females at an early age, because the concept of preventive health checkup is not that prevalent. It's only if your office is, providing you a corporate policy and you are forced to go, because there are certain companies, which say that every year you have to come for a health checkup for, their promotions and also from there people are coming. But if I say that people, on their own, very few youngsters, who are actually willing to come to a gynecologist even before they are sexually active or after they are sexually active to discuss about this problem or discuss about their gynae issues. So they may, come for 101 other issues, but this problem, we still need to create more awareness. I mean, that it's not just the low socioeconomic strata, but even educated females, I mean, somehow they need to find out more time to come to a doctor.
Now, what would be your message on cervical cancer awareness, ma'am? During this period, what would be your message?
As we all know that, prevention is always better than cure. So I would just ask all the females, especially who are in that, age group of 30 to 60 years, to actually start thinking about themselves, about their health. Because, in our country, generally females, they put their family first. But they should, try to put themselves first and come for a regular annual health checkup so that such problems which are preventable like cervical cancer can be treated.
Thank you so much, ma'am, for joining us and sharing all the insight with us.
Thank you.
Thank you.